Hi YouTubers, it's SmokeNancy777 next video today. So, this is obviously pre-recorded. This is going to be the last video in my series of health effects of pipe and cigar smoking. It's going to be long-term. So by long-term I mean 10 years plus, 10 years in one day plus. Now, the long-term health effects you can notice, again, like I said in the past parts, greatly depend on, are you inhaling, which you should not be doing? Are you smoking in moderation, which you should be doing? Are you brushing your teeth regularly, etc., etc., etc. Now, I have not reached a 10-year mark on pipe and cigar smoking. I'll be 28 when I reach a 10-year mark. But from what I've heard, and the stories I've heard, it can be a mixed bag. Some people who just smoke a pipe once, twice a week, smoke a cigar once a week, a couple times a month, usually have very minimal health effects. They're not inhaling, obviously, they're not smoking cigarettes, which is good. They're not chewing on top of it, they're not heavy alcohol users. You know, that's what the majority of what I've heard. I think most people who get into the hobby of pipe and cigar smoking learn to control it, and they don't abuse it. They don't sit there puffing a pipe all day long and chugging beer or chugging vodka, whatever. So, obviously, there are other stories I've heard of. I've heard of some people developing some health effects after 10, 15, 20 years, 30 years of smoking pipe and cigars. I mean, I've heard of a handful of people getting cancer from pipe and cigar smoking. I'm not going to ramble a lot about cancer, but I've heard of maybe a dozen people getting cancer from pipe and cigar smoking. Maybe a little bit more than a dozen. But from what I've heard, it depends greatly. One of the biggest factors is how often you smoke. So if you're smoking 3, 5, 10 times a day, that's going to greatly increase your health effects because it's a chronic irritant to your mouth and your throat. Obviously, if you inhale, it's also to your lungs. But most pipe and cigar smokers don't inhale. So it really depends a lot on factors. Obviously, you should always smoke in moderation. Ideally not smoke at all, but you should smoke in moderation if you do smoke. You should always stay away from cigarettes, chew, dip. That's just going to chronically irritate your mouth and your lungs also. You should always obviously drink in moderation. You should obviously not inhale. So, I've heard mixed stories. I mean, I don't know a whole lot of people who've been smoking for 15, 20, 30, 40, 50 years, but I've heard mixed things. I've heard some people are fine 50 years in the future. Some people after 30, 40, 50 years do have cancer, though I have not heard of a lot of stories. I've heard of a few of people getting like mouth or throat cancer. So, you know, obviously this is directed towards adults. This is not for children. I think it's a risk we all can accept, or some of us can accept. Anyway, comment, rate, subscribe if you want to, and bye.